children, I am Bindu. Welcome you all. Are you ready to learn another new topic? Let us take a deep insight into the topic of reproductive health from the lesson Reproduction of class 10th Biology. Already we have discussed male and female reproductive structures and functions. The process of sexual maturation is gradual and takes place while general body growth is still going on. The process of fertilization is the fission of male and female gametes, the sperm and the egg or ovum. Fertilization occurs in the oviduct, forming the zygote and further growing to form a baby. According to World Health Organization, reproductive health means total well-being in all aspects of reproduction. Learning outcomes. After studying this topic, you will be knowing about reproductive health, definition and measures, sexually transmitted diseases, contraception methods. Keywords: reproductive health, sexually transmitted disease, gonorrhea, syphilis, acquired immunodeficiency syndrome, AIDS, contraception, intrauterine device, vasectomy, tubectomy. Let us see the concept map on reproductive health and different kinds of contraception methods. Reproductive health includes the ability to reproduce and regulate fertility. Women's ability to undergo pregnancy and safe childbirth, maternal and infant survival and well-being. Several measures were undertaken by the government to improve the reproductive health of the people. Government launched national health programs such as the Family Welfare Program, Reproductive and Child Health Care or RCH program. Family Welfare Program. The National Family Welfare Program is a comprehensive scheme that includes maternal and child health care, immunization of mothers, infants and children, nutritional supplement for pregnant women and children, contraception with health education, to have a small family norms, improving the economic status and the quality of life, reproductive and child health care program. It is an integrated program that includes pregnancy and childbirth, postnatal care of the mother and child, importance of breastfeeding, prevention of reproductive tract infections and sexually transmitted diseases. You know that most diseases spread through person-to-person contact. The sexually transmitted diseases spread through sexual contact. Sexually transmitted diseases include bacterial infections such as gonorrhea and syphilis, and viral infections such as warts and AIDS, acquired immunodeficiency syndrome. The human immunodeficiency virus, HIV, causes AIDS. AIDS is spread by unsafe sexual contacts, infected needles or syringes, infected blood transfusion, and from an infected mother to child during pregnancy. The prevalence of a high rate of AIDS cases is observed in states like Andhra Pradesh, Maharashtra, Karnataka, etc. The factors contributing to the spread of HIV include illiteracy, poor health, unemployment, migration, unethical sexual contacts, etc. The government established antiretroviral therapy or ART centers to supply medicine to HIV patients. Medical health, family health departments, and AIDS control projects are implementing various programs. These include ASHA or Accredited Social Health Activist and Red Ribbon Express, etc. to create awareness in society on the risks and symptoms of AIDS, avoiding unethical practices, and early detection and treatment help to control sexually transmitted diseases. Sexual maturity enables the woman to get ready for pregnancy. Pregnancy will make major demands on the body and the mind of the woman. But in case of early or teenage pregnancy, the health of the woman will be adversely affected. Therefore, many ways have been devised to avoid pregnancy. The prevention of pregnancy in women by preventing fertilization is called contraception. Contraception is one of the best birth control measures. Any device or chemical drug used to prevent pregnancy in women is called a contraceptive. Common contraceptive methods used to prevent pregnancy are barrier methods, hormonal methods, intrauterine device, IUDs, surgical methods. Barrier methods. This method prevents sperms from mating the ovum, restricting entry into the female reproductive tract. Condom. Condom prevents the deposition of sperm in the vagina. Condoms are made of thin rubber or latex sheath and protect against sexually transmitted diseases like syphilis and AIDS. Diaphragm or cervical cap. Vaginal diaphragm is used as a fitting into the vagina, or the cervical cap is fit over the cervix to prevent the entry of sperms into the uterus. Hormonal methods. Hormonal preparation are in the form of pills or tablets called contraceptive pills. These hormones stop or interfere with ovulation or the release of eggs from the ovary. Intrauterine devices, IUDs. The intrauterine devices are contraceptive devices inserted into the uterus. There are two synthetic devices commonly used in India: lipase loop and copper T made of copper and plastic. This can remain for a period of 3 years. This reduces sperm fertilizing capacity and prevents implantation. This also helps to give adequate time intervals between pregnancies. Surgical methods. Surgical contraception or sterilization techniques are terminal methods to prevent any pregnancy. This procedure in males is vasectomy or ligation of the vas deferens. In males, a small portion of vas deferens or sperm duct removed by surgical operation and both ends are tied properly. In females, a small portion of oviducts or fallopian tubes is removed by surgical operation and the cut ends are tied. This prevents the ovum from entering into the oviducts. This method is called tubectomy. These are methods of permanent birth control. Fighting against social ills. Teenage motherhood and childbirth are highly complicated. It is important for understanding and get prepared for the maturity of the mind and body before undertaking motherhood. Thus, a girl only after 18 years of age can be said to be prepared for the same. Most of the time, this age is also dangerous to the girl. According to the Department of Family Welfare, 21% of teenage mothers die during delivery. So, girls below 18 years of age should not be married. Stop female feticide. In most sectors and families, the girl child and her education are treated as burden. But no one ever knows what could a girl child achieve. She may become a great scientist, a famous doctor, a top-class engineer, a wonderful teacher, and many more. Stop female feticide. Save the girl child. Due to reckless female feticide, the male-female child sex ratio is declining at an alarming rate in some sections of our society. Our government has already enacted laws to ban the determination of the sex of fetuses. Despite laws, it is our social responsibility of us to prevent female feticide. Points to remember. According to World Health Organization, reproductive health means total well-being in all aspects of reproduction. The sexually transmitted diseases include bacterial infections such as gonorrhea and syphilis, and viral infections such as worms and AIDS. One should be aware of the facts related to the transmission of sexually transmitted diseases. Nowadays, various methods of contraception are available to control childbirth. It is our responsibility to build a healthy society. Determination of sex before birth is illegal. Stop female feticide.